Welcome to the latest edition of Vaccine Research Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. Sanofi has reported new data from its large-scale FLUNITY-HD study involving nearly 500,000 adults aged 65 and older across 2 geographic regions. The findings show that the company's high-dose influenza vaccine, Efluelda, also known as Fluzone High Dose, achieved superior protection compared to the standard dose vaccine. It reduced laboratory-confirmed influenza hospitalizations by 31.9% and also lowered rates of pneumonia or influenza-related hospitalizations, cardio-respiratory events, and all-cause hospitalizations. These outcomes reinforce the benefits of high-dose influenza vaccination for older adults. In South Korea, the Korea Disease Control and Prevention Agency has secured 5.3 million seasonal COVID-19 vaccine doses, including 2.02 million from Moderna. Moderna emphasized that COVID-19 is now circulating year-round, underscoring the need for ongoing vaccination and supporting the co-administration of flu and COVID-19 shots. The company also highlighted an immune response advantage seen in its Phase 3 combination vaccine, which may influence future national immunization strategies. VitriVax has raised $17.25 million in a Series B round, co-led by Adjuvant Capital and RA Capital, with prior support from the Gates Foundation, CEPI, and the U.S. Department of Defense. The funding will advance the company's thermostable, single-shot ALTA platform toward Phase 1 readiness. Designed to overcome cold chain and multi-dose storage challenges, this innovation could improve global vaccine access, particularly in low-resource settings. GSK's shingles vaccine, Shingrix, has received a positive opinion from the European Medicines Agency's CHMP for a new prefilled syringe presentation. This version aims to simplify administration compared with the current 2-vial formulation that requires reconstitution. A final decision from the European Commission is expected in December 2025, and the new format could enhance convenience for healthcare providers and patients alike. Sanofi has decided to discontinue development of its toddler RSV vaccine candidate, SP0125, following an independent committee review indicating that the Phase 3 study was unlikely to demonstrate efficacy. The intranasal live attenuated vaccine was tested in about 6,300 children aged 6 to 22 months. Safety was reported as acceptable, with no vaccine-associated enhanced respiratory disease signals. The decision reflects Sanofi's ongoing strategic focus on antibody-based RSV prevention. Singapore's Health Sciences Authority has approved the LP.8.1 adapted monovalent COMIRNATY vaccine from Pfizer and BioNTech for individuals 6 months and older. This updated formulation, aligned with recommendations from the FDA, EMA, and WHO, targets the LP.8.1 variant within the JN.1 lineage and marks the first such authorization in Southeast Asia. The update strengthens the region's preparedness for the upcoming respiratory virus season. Moderna has announced that its Phase 3 trial for the congenital CMV vaccine, mRNA-1647, did not meet its primary endpoint. Conducted in approximately 7,500 women across 13 countries, the study showed vaccine efficacy between 6 and 23%, depending on the case definition. Despite an acceptable safety profile, the company has decided to discontinue the congenital program while continuing studies of the vaccine in transplant reactivation settings. In oncology, Evaxion Biotech, in collaboration with Merck, has reported encouraging Phase 2 data for EVX-01, a personalized peptide-based neoantigen vaccine combined with pembrolizumab. Among 16 evaluable patients with advanced melanoma, the treatment achieved a 75% overall response rate, with 11 of 12 responses ongoing at 24 months. The vaccine induced broad T-cell activation, and no grade 3 or higher vaccine-related adverse events were reported, highlighting its potential role in personalized cancer immunotherapy. Stay ahead in vaccine research, like, share and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert health